We're going to talk about documenting medical procedures. Believe it or not, this is actually easy, especially compared to E&M documentation and coding. Procedure documentation has no clear guidelines like for E&M services. It varies considerably by hospital and surgical center, also somewhat by insurer. It's important to learn the rules that apply to you. Basic procedure documentation is very straightforward. The procedure name, a pre-procedure diagnosis, a post-procedure diagnosis, the indications for the procedure, the performing physician, any anesthesia that is used, estimated blood loss, fluids, and other complications. There should also be a narrative describing operative findings, techniques, specimens obtained, drains or tubes, and any specific complications. Good documentation defines the procedures that you perform and the medical necessity of those procedures. Consider template-based documentation for procedures that you perform commonly. It makes it very easy and efficient. With the healthcare challenges of cost, quality, and value, clear and consistent procedural documentation is essential. Procedure coding is fairly straightforward for simple procedures, but major surgery coding is complex. It's usually done by a professional coder. It's based on the operative report, so better documentation results in better reimbursement for the procedure or procedures that you perform. And there are many modifiers to the procedural CPT codes, which is one of the reasons why the assistance of a professional coder is required. So why is all of this important? Why do we need to take this much time to document a procedure? Well, it is important because of the compensation model used by most medical practices, where you have a productivity component, and accurate documentation and coding will definitely influence that. It's also important with the triple challenge of healthcare of cost, quality, and value. Excellent documentation reflects the quality and value your service is providing to the patient and the healthcare system. So in summary, the documentation requirements for procedures are less clear, professional coding assistance is usually needed, and mastery of this skill is essential for the financial success of procedurally oriented physicians.